I keep seeing the same pattern in people around 70. They come in concerned about memory, and they tell me they're doing everything right. They're taking their supplements, they're doing crossword puzzles every morning, they've downloaded 3 brain training apps, they feel like they're working hard at prevention. And then they ask me why it doesn't seem to be helping, why they still feel foggy by afternoon, why names slip away mid-sentence, why they walk into a room and forget why they're there. And when I ask them about their daily routine, I start to see the same underlying issue. It's not that they're doing the wrong things exactly, it's that they're doing them in the wrong order. They're trying to strengthen the pump when the hose has a kink in it. That metaphor probably sounds strange, so let me stay with it for a moment, because it's the clearest way I know to explain what I see happening. Imagine your brain's blood flow like water moving through a garden hose. If the hose has a kink, it doesn't matter how strong the pump is. The water doesn't get through. Most people focus all their energy on strengthening the pump, exercise, mental stimulation, diet changes, without ever checking for the kink. And the kink, in this case, is something we almost never talk about in dementia prevention conversations. It's not dramatic. It doesn't make headlines. But it's there, and it's limiting everything else you're trying to do. Now, I want to be clear about something before we go further. If you're finding any of this useful, maybe just tap the like button, not because I need the validation, but because it helps me know what kind of content is actually landing with people who are thinking seriously about these questions. No pressure, just if it's helpful. The misconception I want to address today is this. Most people believe that dementia prevention is about adding things. Adding brain games, adding supplements, adding more social activity, adding Mediterranean diet principles, and all of those can matter. But the single biggest mistake I see, and I mean this happens in at least 6 out of 10 conversations I have with patients over 60, is that people are trying to build cognitive reserve on top of a system that's already under strain. They're adding weight to a foundation that's cracked. And the crack is something most of us create ourselves without realizing it every single day. It's chronic low-grade stress to the vascular system, not the stress you feel. The stress your blood vessels experience, the kind that comes from sustained, unnoticed tension in how you hold your body, how you breathe, how you move through your day. And here's why this matters more than almost anything else. Your brain is roughly 2% of your body weight, but it uses about 20% of your oxygen supply. It's incredibly resource hungry. And if the delivery system, your blood vessels, is constantly in a state of mild constriction, you're starving your brain, slowly, quietly, even while you're doing all the right things. Let me give you an example. 2 people, both 72, both retired, both concerned about memory, both doing crossword puzzles, both taking fish oil, both walking 30 minutes a day. Same zip code, similar education, similar family history. One of them comes in and tells me she feels sharp most of the day, occasionally forgets a name, but it comes back. The other one tells me she feels like she's thinking through fog. She's frustrated. She wonders if it's early dementia. I run the same basic screening on both of them. Cognitively, they score almost identically. So, what's different? When I start asking about their daily patterns, it becomes clear. The first woman wakes up slowly. She lies in bed for a few minutes, takes a few deep breaths, stretches gently before getting up. She moves through her morning without hurry. The second woman wakes to an alarm, sits up quickly, checks her phone, starts mentally listing everything she has to do, holds her shoulders high and tight all morning, and doesn't realize she's been breathing shallowly for hours. She's not anxious exactly, she's just tense, physically tense, all day. Her body is in a low-grade fight-or-flight state that she doesn't even notice anymore because it's become her baseline. And here's the part that most people don't understand. That tension constricts blood vessels. Not dramatically, not enough to cause a stroke, just enough to reduce flow. And when you reduce flow to a brain that's already aging, already losing some of its redundancy, already working harder to maintain the same level of function, you're making everything harder. You're trying to run high-performance cognition on a restricted fuel supply. Now, I know what some of you might be thinking. You're thinking, but I'm not stressed. I'm retired. I don't have work pressure anymore. And I believe you. I'm not talking about psychological stress. I'm talking about something more subtle. I'm talking about the way your body holds itself when you're concentrating, the way your jaw clenches when you're reading something difficult, the way your shoulders creep up toward your ears when you're cooking or folding laundry, or even just sitting and watching television, the way you brace yourself physically without knowing you're doing it. This is what I mean by the kink in the hose. It's not a disease. It's not a diagnosis. It's a pattern. And the reason it matters so much for dementia prevention is that your brain's waste clearance system, the glymphatic system, which clears out metabolic debris while you sleep, depends on good blood flow. If your blood vessels are chronically slightly constricted, that system doesn't work as well. Waste products build up more slowly. Over years, that accumulation contributes to the very changes we associate with cognitive decline. So the question becomes, how do you release the kink? And this is where I see people make another mistake. They think the answer is to add a relaxation practice. Meditation, yoga, progressive muscle relaxation. And again, those can help. But if you're doing them as another item on your to-do list, if you're trying to achieve relaxation the same way you're trying to achieve brain health, you're just adding more strain to the system. You're trying to relax effortfully, which is a contradiction. What works better, and I've seen this shift things for people in ways that surprise them, is to insert a single tiny release point into your day. Not a practice, not a routine, just a moment, 30 seconds. Maybe 60. A moment where you do nothing except let your body soften. You don't have to sit down. You don't have to close your eyes. You don't have to stop what you're doing. You just soften. Let your shoulders drop. Let your jaw unclench. Let your belly relax. Take one full breath that fills your lungs all the way down, and then go back to what you were doing. That's it. That's the entire intervention. And I know it sounds too simple to matter. But here's what happens physiologically. When you release physical tension, even briefly, your parasympathetic nervous system gets a signal. Your blood vessels dilate slightly. Flow improves. Oxygen delivery improves. And if you do this multiple times throughout the day, not as a scheduled practice, but just as a habit, like brushing your teeth, you start to shift your baseline. Your body starts to remember that it doesn't have to be braced all the time. Now, I'm not saying this replaces exercise or cognitive engagement or a healthy diet. I'm saying it's the thing you do first. It's the kink you release before you try to strengthen the pump. Because when blood flow is good, everything else you're doing works better. The walk you take delivers more oxygen. The puzzle you solve happens on a brain that's better fueled. The sleep you get clears waste more efficiently. Let me give you another contrast because I think this helps. Two men, both 68, both with mild hypertension, well controlled on medication, both eating reasonably well, both concerned about their father's dementia history. One of them comes in and tells me he's been doing everything he can think of. He's taking ginkgo biloba, he's doing Sudoku, he's cut out sugar, he's reading articles about brain health every week. But he still feels like his memory is slipping. The other man comes in and says he's not doing anything special. He's just trying to stay calm. He's been practicing letting go of tension throughout the day. He's not rigid about it. He just notices when he's clenched and lets it go. And when I assess them, the second man is sharper. Not because he's doing more, because he's straining less. This is what I mean by working with your system instead of against it. Your brain is designed to function well when it has what it needs: oxygen, glucose, waste clearance. But if you're chronically constricting the delivery system, you're undermining all of that. And the tragedy is that most people don't realize they're doing it. They think tension is just part of aging. They think it's normal to feel tight. They think everyone's shoulders are up by their ears, and so they never question it. They just keep adding interventions on top of a restricted foundation. Now, let's talk about what this means practically. If you're over 60 and you're concerned about cognitive decline, here's the question I want you to start asking yourself. Not, am I doing enough? But am I allowing flow? Not, what should I add? But where am I constricting? And the way you answer that is by paying attention to your body in small moments throughout the day. When you're reading, are you holding your breath? When you're standing at the kitchen counter, is your jaw tight? When you're sitting and watching something, are your shoulders raised? These are not moral failures, they're just habits, and habits can shift. The practice I recommend, and I'm calling it a practice only because I don't have a better word, but really it's just a habit, is this. Set a soft intention to notice tension 3 or 4 times a day. Not on a schedule, just when you remember, maybe when you stand up. Maybe when you wash your hands. Maybe when you're waiting for something to load on your computer. In that moment, take 5 seconds and do a quick body scan. Shoulders, jaw, belly, breath. If anything's tight, let it soften. If your breath is shallow, take 1 full breath. And then move on. That's the whole thing. It takes less time than brushing your teeth. But if you do it consistently, over weeks and months, you start to retrain your nervous system. You start to shift your baseline from braced to open. And when your baseline shifts, your brain gets more of what it needs. Blood flow improves, oxygenation improves, waste clearance improves, and all the other things you're doing, the walking, the puzzles, the social connection, start to work better, because they're happening on a system that's no longer fighting itself. Now I want to address something I hear a lot. People ask me, but isn't some tension necessary? Don't I need to stay alert? If I relax too much, won't I lose my edge? And I understand the concern. But here's the distinction. I'm not talking about mental relaxation. I'm not talking about losing focus or becoming passive. I'm talking about physical release. You can be mentally sharp and physically soft at the same time. In fact, you're sharper when you're physically soft because your brain has better access to resources. Think about it this way. When you're physically tense, your body interprets that as a signal that you're in danger. It shifts resources toward survival. It prioritizes quick reactions over deep thinking. It reduces blood flow to non-essential areas. Your brain still works, but it's working in a constrained mode. When you're physically released, your body interprets that as safety. It allows resources to flow more freely. Your brain gets more fuel. You think more clearly. You remember better. You process information faster. This is not speculation. This is basic physiology. Chronic muscle tension activates your sympathetic nervous system. That system constricts blood vessels. It's a survival mechanism. It's useful if you're being chased. It's not useful if you're trying to remember where you put your keys. And the problem is that most of us live in a state of chronic low-grade activation that we don't even notice. We've adapted to it. It feels normal, but normal doesn't mean optimal. So here's the reframe I want you to consider. Dementia prevention is not just about building cognitive reserve. It's about reducing cognitive drag. And one of the biggest sources of drag, maybe the biggest, is chronic physical tension that restricts blood flow. You can do all the brain training in the world, but if your brain is running on restricted oxygen, you're working against yourself. Now let's talk about expectations, because I think this is where a lot of people get discouraged. If you start doing this, if you start releasing tension throughout the day, you're not going to feel a dramatic shift overnight. You're not going to wake up the next morning with perfect memory. This is not a quick fix. But what you might notice over a few weeks is that you feel a little less foggy in the afternoon. That names come back a little more easily. That you're not as mentally exhausted at the end of the day. These are subtle changes. But subtle changes, sustained over months and years, make a real difference in how your brain ages. And here's the other thing I want you to understand. This is not a pass-fail situation. You don't have to do this perfectly. You don't have to remember every time. If you notice tension and release it 3 times today, that's 3 times your brain got a little more oxygen than it would have otherwise. If you forget tomorrow, that's fine. This is not a test. It's just a gentle reorientation toward allowing your body to function the way it's designed to. I also want to talk about the difference between this approach and the usual advice you hear about stress management. Most stress management advice is about changing your circumstances or your thoughts. Take a vacation. Think positive. Practice gratitude. And those things can help. But they don't address the physical pattern. You can be grateful and tense at the same time. You can be on vacation and still holding your shoulders up by your ears. The physical tension is a separate layer, and it responds to physical release, not to mental reframing. This is why I keep coming back to the hose metaphor. You can pour all the fertilizer you want on a garden, but if the hose is kinked, the water doesn't reach the roots. You can do all the cognitive interventions you want, but if your blood vessels are chronically constricted, your brain doesn't get the fuel it needs. Release the kink first, then everything else works better. Now, let me be very clear about when you should be concerned and when you should call your doctor. If you're noticing memory changes that are interfering with your daily life, if you're forgetting appointments, getting lost in familiar places, having trouble managing finances, or if people around you are expressing concern, those are signs you need a clinical evaluation. Don't wait. Don't assume it's just aging. Get assessed. What I'm talking about today is not a substitute for medical evaluation. It's a complement. It's something you can do alongside whatever clinical care you're receiving. But if you're in the category of normal age-related change, occasional forgetfulness, slower recall, needing to write things down more often, and you're worried about prevention, this is where the tension release practice can make a real difference. It's not going to reverse pathology, but it can reduce the daily strain that accelerates decline, and that matters. Here's another way to think about it. Imagine two identical cars, same make, same model, same year. One of them is driven with the parking brake slightly engaged all the time. Not enough to stop the car, but enough to create drag. The other one is driven with the brake fully released. Over time, which car is going to last longer? Which engine is going to run more smoothly? The one that's not fighting itself. That's what we're talking about here. You're not trying to build a better engine. You're trying to release the brake. And the beautiful thing about this approach is that it costs nothing. It requires no equipment. It doesn't depend on your schedule, or your location, or your fitness level. You can do it right now. You can do it while you're listening to this. Just notice if there's any tension anywhere in your body. Shoulders, jaw, belly, hands. If you find it, let it go. Take one full breath, and then keep listening. That's it. You just gave your brain a little more oxygen. You just reduced drag. You just did something meaningful for your cognitive health. Now, I know some of you are thinking, this can't be enough. This is too simple. There has to be more. And I understand that feeling. We live in a culture that values effort and complexity. We think that if something is easy, it can't be powerful. But physiology doesn't care about our cultural values. Physiology responds to what works, and what works in this case is giving your body repeated small signals of safety so it can shift out of chronic low-grade defense mode. Think about it this way. If you're holding a weight in your hand, even a light weight, and you hold it for hours without putting it down, your hand gets tired, your arm gets tired, your shoulder starts to ache, but you're so used to holding it that you forget it's there. You just accept the fatigue as normal. And then someone says, "Why don't you put the weight down?" And you think, that can't be the answer. It's too simple. But when you finally put it down, you realize how much effort you were using. You realize how much easier everything becomes when you're not carrying that constant load. That's what chronic tension is like. It's a weight you're carrying without realizing it. And the solution is not to get stronger at carrying it. The solution is to put it down repeatedly throughout the day until not carrying it becomes your new normal. Now let's talk about how this fits with other prevention strategies, because I don't want you to hear this and think it's the only thing that matters. It's not. Exercise matters, cardiovascular health matters, sleep matters, social connection matters, cognitive engagement matters, diet matters. All of those things contribute to brain health. But here's what I've seen in practice. When people are chronically tense, all of those other interventions work less well. Exercise feels harder. Sleep is less restorative. Social connection feels draining. Cognitive tasks feel like more effort than they should. When you release the physical tension, everything gets easier. Not because the tasks themselves change, but because you're no longer fighting your own nervous system while you do them. You're working with your body instead of against it. And that shift from resistance to flow makes a bigger difference than most people realize. So here's what I'm suggesting. Before you add another supplement, before you sign up for another brain training program, before you overhaul your entire diet, try this. For the next 2 weeks, just notice tension and release it 3 or 4 times a day, whenever you remember. See what happens. See if you feel any different. See if tasks feel a little easier. See if your mind feels a little clearer. And if it helps, keep doing it. If it doesn't, you've lost nothing. But I think you'll be surprised. Now, I want to talk about one more thing before we wrap up, and that's the social dimension of this. One of the things I've noticed is that people tend to mirror the physical tension of the people around them. If you're sitting with someone who's tense, you unconsciously tense up too. If you're around someone who's physically relaxed, you tend to soften. This is part of how our nervous systems co-regulate. We're social creatures. We pick up on each other's physical states. So if you start practicing this release, you're not just helping yourself. You're potentially helping the people around you. Your spouse, your friends, your grandchildren. They might not consciously notice what's different, but their nervous systems will pick up on the fact that you're less braced. And that gives them permission to soften too. This is how change spreads. Not through lectures or advice, but through presence, through modeling a different way of being in your body. And that brings me to my last point. This is not about perfection. This is not about getting it right. This is about gradually, gently shifting your relationship with your own body. It's about noticing when you're fighting yourself and choosing in small moments to stop. It's about recognizing that your brain is part of your body and that how you hold your body affects how your brain functions. It's about releasing the kink so everything else can flow. I see a lot of people over 60 who are terrified of dementia, and I understand that fear. It's a rational fear, but what I want you to understand is that fear itself creates tension. And tension restricts flow, so the very act of worrying about your brain can paradoxically make your brain work less well. This is not about denying the risk. It's about responding to the risk in a way that actually helps instead of creating more drag. And here's the last thing I'll say. If you found any of this useful, consider saving this video or sharing it with someone who might benefit. Not because I need the views, but because this is information that doesn't get talked about enough. Most dementia prevention advice focuses on what to add. Very little of it focuses on what to release. And I think that's a gap that needs filling. If you want to go deeper into practical health conversations like this, consider subscribing to the Everyday Health Podcast. We try to cut through the noise and focus on what actually matters for people who are thinking seriously about aging well. And if you haven't already, turn on notifications so you don't miss the next one. I'd also be curious to hear, when you checked in with your body just now, where did you notice the most tension? Shoulders? Jaw? Somewhere else? Just think about that. You don't have to answer, but noticing is the first step, and sometimes noticing is enough.